Imagine the joy of discovering you're expecting, only to have that dream and suddenly within the first few weeks. Miscarriage is more common than many realize, yet still surrounded by silence and misunderstanding. Introduction and common timing of miscarriages. Miscarriage, also called spontaneous abortion in medical terminology, refers to the natural loss of a pregnancy before the fetus is viable outside the womb. Most miscarriages occur in the early weeks of pregnancy, particularly within the first trimester. Research consistently shows that the majority of pregnancy losses happen in the first 12 to 13 weeks, which is why this period is considered the most vulnerable. Clinical studies suggest that about 10 to 20% of recognized pregnancies end in miscarriage, but the actual percentage may be higher since many very early pregnancies end before a woman even realizes she is pregnant. These are sometimes called chemical pregnancies, which are detected only by hormone tests but resolve around the time of an expected menstrual cycle. The signs of a miscarriage often include vaginal bleeding, abdominal or back cramps, and sometimes the passage of tissue. However, bleeding alone does not always mean a miscarriage is certain, which is why medical evaluation is essential. Understanding that most miscarriages occur early helps explain why health professionals often wait until after the first trimester to consider a pregnancy relatively stable. This timing also highlights the importance of careful monitoring during early pregnancy and the need for women to seek medical advice quickly if they experience unusual bleeding or pain. Why early miscarriages are most common? The reason miscarriages are most common in the first trimester is largely related to chromosomal abnormalities in the developing embryo. When the genetic material of the embryo is not correctly formed during fertilization or early cell division, the pregnancy often cannot progress normally. Studies estimate that at least half of early miscarriages are due to such chromosomal issues. These abnormalities usually happen by chance and are not the result of something the parents did or failed to do. Other risk factors that may increase the likelihood of miscarriage include advanced maternal age, especially women over 35, previous miscarriages, uncontrolled medical conditions like diabetes or thyroid disease, immune system problems, and certain infections. Environmental factors, such as exposure to toxic substances, may also play a role. However, it is important to emphasize that in most cases, early pregnancy loss happens because the embryo itself was not developing properly, not because of anything the mother did. This explains why many women who miscarry can go on to have healthy pregnancies afterward. Understanding the biological basis of early pregnancy loss can help reduce feelings of guilt or self-blame that are very common after such an event. Second trimester miscarriages and later pregnancy loss. While most miscarriages occur in the first trimester, pregnancy loss can also happen in the second trimester, between 13 and 20 weeks of gestation. These are less common and are often referred to as late miscarriages or second trimester losses. The causes of miscarriage in this period are usually different from those in the first trimester. Instead of chromosomal issues, factors such as structural abnormalities in the uterus, cervical insufficiency, when the cervix opens too early, blood clotting disorders such as antiphospholipid syndrome, and severe infections can contribute to second trimester loss. Problems with the placenta, such as placental abruption, can also play a role. Pregnancy losses that occur after 20 weeks are usually classified differently and are called stillbirths or intrauterine fetal deaths. Stillbirths are relatively rare but carry significant medical and emotional impact. Because second trimester losses are less frequent and often linked to identifiable medical problems, healthcare providers may recommend more thorough testing and interventions if such a loss occurs. Management and prevention strategies depend heavily on the underlying cause and may include surgical correction of uterine issues, medication to manage clotting problems, or closer monitoring in future pregnancies. Risk factors, prevention, and common misconceptions. Miscarriage is surrounded by many myths and misconceptions. For example, light exercise, sexual activity, or drinking a cup of coffee in moderation are not usually responsible for miscarriage, even though some people fear these activities. On the other hand, Lifestyle choices such as smoking, excessive alcohol consumption, drug use, and very high caffeine intake have been shown to increase the risk of miscarriage. Certain medical conditions, including poorly controlled diabetes, thyroid disease, and autoimmune disorders like lupus or antiphospholipid syndrome, can also raise the risk. The good news is that in many of these cases, appropriate medical management can reduce the chances of recurrence. Nevertheless, it is essential to understand that most early miscarriages cannot be prevented because they're usually due to random genetic problems in the embryo. Women who have experienced one or even two miscarriages often go on to have healthy pregnancies later. It is typically only after 3 or more consecutive miscarriages that doctors recommend a more comprehensive evaluation for underlying causes. Emotional support and reassurance are also critical because miscarriage is not only a physical event, but also a deeply emotional and sometimes traumatic experience. Access to accurate information and supportive healthcare can make a significant difference in recovery and future pregnancy planning. What to do if miscarriage symptoms occur, and looking ahead if a pregnant woman experiences symptoms such as vaginal bleeding, persistent abdominal or back pain, dizziness, or sudden loss of pregnancy-related symptoms, it is important to contact a healthcare professional immediately. Doctors may use ultrasound scans, blood tests measuring pregnancy hormones, and physical examinations to determine whether the pregnancy is still viable or if a miscarriage is occurring. If a miscarriage is confirmed, medical teams will guide the woman through safe management, whether through natural passage, medication, or a minor surgical procedure. Recovery after miscarriage is both physical and emotional. Doctors often recommend waiting a certain period, which may be a few weeks to a few months, before trying to conceive again, depending on the woman's health and circumstances. Emotional support is just as important. Support groups, counseling, and open conversations with family and friends can help women and couples cope with the grief. It is also reassuring to know that most women who experience a miscarriage will later have successful pregnancies. Careful medical follow-up, attention to health conditions, and maintaining a healthy lifestyle can improve future outcomes. Ultimately, while miscarriage is a painful and challenging experience, understanding its timing, causes, and management can help women feel empowered and hopeful about their reproductive future.